My name is Alex Zhao. I'm a graduate student in bioengineering at the University of Washington, and I'm here today with miPS Bank, which is the first consumer cell bank that can generate an organ when you need it. This is a video of my research, or it would be if this was working. Here we go. This is a video of my research, and these are beating human heart cells. And we study the heart because in the United States, heart disease is a massive problem. Over 600,000 people will die this year in the US from heart disease. And to put that number into perspective, that's the entire city of Seattle's population. And there's no cure for heart disease. So this video is particularly exciting because these heart cells weren't taken from any heart. But I grew these cells in a petri dish in my lab using stem cells. And this is the technology that will be able to regenerate your heart. In fact, at the University of Washington, we are already using stem cells to regenerate hearts of damaged monkey hearts. And across the world, scientists are using stem cells to grow every organ in the human body. And some of these stem cells are in clinical trials today. But in order to grow an entire organ, you need an extremely large amount of high-quality stem cells. And the cells that I work with are called iPS cells, or induced pluripotent stem cells. Induced pluripotent stem cells are particularly unique because we derive them from adults, and they can turn into any organ in your body. But there's a catch. As you grow old, your stem cells will grow old with you, meaning the best time to generate your iPS cells is actually right now. The longer you wait, the more difficult it is to generate a large amount of iPS cells that we might need to use for you in the future. So our solution is miPS Bank. miPS Bank is the first consumer stem cell bank and would work in a fairly simple manner. Any consumer can come in, give a blood or urine sample, and from that sample, we can take their cells, transform them into iPS cells, and grow and characterize these cells. Once we grow and characterize these cells, we can then bank the cells for the consumer's use. We can license these cells to research institutions, and in the future, we hope to grow entire organs. So here we go through the animations. And our vision of miPS Bank, our actual goal of miPS Bank, is bringing cutting-edge biotechnology to consumers. We think that by bringing this technology to consumers, we can accelerate medical research and deliver therapies faster. Ultimately, our vision of the future is that any patient who develops an illness can go to their doctors and, using their bank stem cells, generate an organ for them when they need it. miPS Bank would work, while we can generate organs, or we're working towards generating organs, storing your iPS cells can have immediate benefits today. So we can actually take your iPS cells, turn them into neural cells, and treat these cells as drugs. So let's say you develop depression. On the left is a list of every antidepressant that's on the market. And on the right is a list of all the side effects. So instead of you trying every different drug and going through these side effects, you can actually use your iPS cells to screen these drugs for you, letting your cells be the guinea pig and not you. miPS Bank would generate revenue by targeting two specific two specific models. First, we target consumers to generate iPS cells. We charge them a one-time reprogramming fee as well as an annual storage fee on par with the cost of a Netflix subscription. We'd also work with research institutions by offering them an iPS production service as well as licensing our cell lines to them. And the cost of miPS Bank is actually fairly small. Once we establish a facility, we store our iPS cells in a plastic tube like this. So the main recurring costs are actually personnel, utilities, and reagents like these inexpensive plastic tubes. We'd reach the consumers by working with the University of Washington and Medical Center and their affiliated research institutions to work with doctors to reach their patients, and we hope to expand to other local institutions in the area. By working with the University of Washington, we can also use their experience and resources to navigate regulatory and IP concerns in this emerging field. We hope to start miPS Bank sometime next year by establishing a miPS Bank facility. Once we establish a facility, we can then begin to acquire customers and grow our cell bank. Once our cell bank has been established, we can license cell lines to generate additional revenue, and in the future, we hope to expand to additional institutions. I started miPS Bank as a way to bring stem cell technology to consumers, and I'm working with a small group of entrepreneurs, biomedical engineers, and regulatory experts with over 50 years of experience to get miPS Bank off the ground. But since we're still small, we're looking for connections, network, and support to get this bank started as fast as possible. Because while this might sound like science fiction, medical advancements are being made every day, and we're on the cusp of a medical revolution. So with your support, we hope to make this vision of the future a reality. Thank you.